Hello, this is Gist Nigeria. Coming up on the program, a cure or otherwise, we highlight claims and counterclaims surrounding the use of hydroxychloroquine in the treatment of COVID-19. Also, tradition and sport. We see how ram fighting is fast becoming a vibrant business in Nigeria. And we examine the impact of COVID-19 on agriculture in Ghana and see how farmers are coping. Plus,
my name is Remy Dada. Check me out.
Meet the architect and designer with a passion for transforming office spaces into inspiring environments. Welcome to Gist Nigeria from the BBC and Channels TV, where we bring you fresh insights to stories you like, share and tweet about on social media. I'm Ajoke Hulotse. Our top story this week. Till date, there has been no cure or vaccine for COVID-19. However, there have been conversations on whether or not hydroxychloroquine should be used in the treatment of COVID-19. But what is hydroxychloroquine and why is it surrounded by so many controversies? Gist Nigeria's Wale Fakile tells us the facts in this explainer.
Throughout the world, the coronavirus death toll is continuing to rise with over 17 million confirmed cases. But many of those who have survived have gone on to make full recovery. Health systems around the world are still grappling to contain the pandemic that has forced us to adapt to a new normal since the virus surfaced last year in China. So, what is being done to find a cure or effective treatment? Over 150 drugs are being researched in different countries. Most are existing drugs that are being trialed against the virus. These efforts have birthed a cocktail of drugs and vaccines, with some now at different stages of clinical trials at the World Health Organization.
The main one that we're giving us was an antiviral drug that messes up your whole system. Like, it has adverse drug effects. It could go waste out, it could go mild. But I think mine wasn't mild and it wasn't extreme. It was in moderate. Between. Because for like 72 hours I was throwing up straight. So either I take anything, I don't take anything, like I was constantly throwing up for 72 hours. And then the throwing up stopped, then the diarrhea started. The diarrhea started, and then diarrhea was on and off, on and off, on and off. And whenever I complain, they say, oh, it is the effect of the drug.
While the trials are ongoing, there have been a lot of claims and counterclaims on the efficacy of some of these medicines. But one drug appears to have stoked the most controversy. You guessed right, hydroxychloroquine. What is hydroxychloroquine and why has it attracted so much attention? Well, the drug was thrown into the COVID cure conversation earlier this year by President of America, Donald Trump.
I think it's another day. I had a 2-week regimen of hydroxychloroquine, and I've taken it, I think, just about 2 weeks. I think it's another day. And I'm still here. I'm still here. And I tested very positively in another sense. So this morning, I tested positively toward negative, right? So no, I tested perfectly this morning. Meaning I tested negative.
A well-known treatment for malaria, arthritis and lupus, hydroxychloroquine was first touted by President Trump in March as being effective in the treatment of COVID-19. He says he has used it as a preventive measure, and President Bolsonaro of Brazil also claims to have taken it. The drug was developed during World War II as a derivative of chloroquine with less severe side effects. It is used to reduce fever and inflammation, and the hope has been that it can also inhibit the virus that causes COVID-19. But despite some early studies raising hopes, one subsequent larger-scale trial has shown it's not effective as a treatment. So, in May, The WHO temporarily suspended the use of the drug after one study suggested it can increase the risk of patients dying from COVID-19.
The executive group has implemented a temporary pause of the hydroxychloroquine arm within the Solidarity trial while the safety data is reviewed by the Data Safety Monitoring Board.
And on July 4th, the Apex Health body altered clinical trials of the drug, saying it doesn't reduce death rates in patients with coronavirus. Hydroxychloroquine was, however, in the news again in late July after social media companies took down the video of some right-wing American doctors throwing their weight behind the drug. But before the removal of the video, it had been viewed over 17 million times on Facebook and was shared on Twitter by Trump and his supporters. The video also trended on Nigerian social media, raising speculation about the potential benefits and harmful effects of the drug. So, where does Nigeria stand in this conversation over the use of hydroxychloroquine to treat COVID-19?
There's currently an ongoing randomized clinical trial in the country utilizing chloroquine, hydroxychloroquine, and some other therapeutic agents. And that RCT, the randomized control trial, is actually the gold standard for ascertaining which drug is the drug of choice for any infections, for any disease at all, not just COVID-19. And this is something that we all know from science, that RCT is the gold standard. And until that happens and evidence shows that hydroxychloroquine is a drug of choice for managing COVID-19 or treating COVID-19 patients, we will continue to advise caution and ask people not to self-medicate.
In Lagos State, the epicenter of the pandemic in Nigeria, health authorities have been quoted as saying the state had begun using the drug for clinical trials. But this was as far back as in May. So what is the verdict now?
We're currently working with Lagos University Teaching Hospital to conclude that trial and provide information on the Nigerian patients and our experience. We should be able to determine what the situation is with the drug. Of course, we would not have as many patients as is available to the advanced countries or the big trials. And this is simply because we don't have enough funds to conduct such trials.
There's been some hope that hydroxychloroquine could be effective if used early on when a person gets the virus, before there's a need for hospitalization. But there's been no clear evidence on this, and even its effectiveness in the early stages of infection has not been proven. There are in fact more than 200 trials currently underway globally on its impact either as a prophylactic or treatment for COVID-19. The WHO is now advising people not to self-medicate, cautioning physicians and medical associations recommending or administering this, quote, unproven treatments, end of quote.
Already we know that one drug, dexamethasone, can help patients with severe disease. And we know that two other therapeutics, hydroxychloroquine and lopinavir, ritonavir, offer little or no benefit. More than 5,500 patients in more than 20 countries have joined WHO Solidarity trial, which will help answer questions about which treatments are most effective.
There have also been reports of people poisoning themselves, taking the drug without medical supervision. So, while promotion by leading political figures such as Trump has led to a high demand for the discredited hydroxychloroquine, there is still no known cure or treatment for COVID-19 globally accepted or recognized.